This podcast is recorded on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people.
British Columbia, I've seen your mountains high, seen your pretty rainbows and your blue crystal skies, watched your winding rivers as they flow around the bend. To me you're not a stranger, you'll always be a friend.
Coming to you from the West Coast, this is Politicos. Today is June 13th, 2019, and this is episode 142. Politicos is the BC Politics Podcast. Tell us what you think of the show by filling out our survey at politicos.ca/survey or get at us on social media. Most importantly, help us build the show by throwing us a couple bucks a month at patreon.com/politicos.
I'm Scott Deleneboom.
And I'm Ian Bushfield. On today's show, we're going to talk about whether this election is going to be fought over pharmacare. Politicos is in partnership with BC Today, British Columbia's daily newsletter dedicated exclusively to BC politics. Sign up for a free trial to have unique coverage of the BC legislature delivered to your inbox every morning. Listeners to Politicos enter the offer code CITIZEN for access to a special rate. For your free 2-week trial of the newsletter, go to britishcolumbiatoday.ca. As I mentioned off the top there, we've launched a listener survey. Patrons will have gotten that invite link in their email. General listeners, like I said, go to politicos.ca/survey. Tell us what you think of the show. Tell us what you like. Tell us what you don't like. Tell us what guests we should get on. We'll listen to some amount of the feedback if we think it's useful. We're generally just trying to improve the show, make sure it's delivering what people have come to enjoy, or get rid of what they don't. The other thing that's coming up is we're at episode 142, which means we're only 8 weeks away from our 150th episode. We've done events at our 50th and 100th, so we figure it's time for another live show, and that will take place on August 8th. So we're still trying to secure a venue, trying to secure some guests and figure out how to make it. We promise it will go shorter than our previous shows.
The 100th wasn't too bad. It's the 50th that really
went a little
long.
overboard. That was 2 podcasts in one, where we just got progressively more drunk. We will do less podcasting, let's say, but we'll still have a good time. Stay tuned for further details on that 150th show at this space. Follow us on Facebook and Twitter. It'll be announced in all those places. Or become a patron, and you'll probably be the first to know and get discounted tickets for it. Well, let's jump into the only segment this week. It's been a quiet week. Let's drug Canadians. The federal government's pharmacare report is out. This was the report of Dr. Eric Hoskins, who I believe is the former Ontario health minister from the provincial Liberal government, that Trudeau and Bill Morneau had announced this blue ribbon review of what would a pharmacare system look like in Canada and how can we make sure drugs are affordable for Canadians. I think there was a lot of skepticism going into this report. People who've been calling for a bold, universal pharmacare system were worried this was going to come back with a piecemeal approach. And instead, they basically adopted the NDP's plan, but like on a slower timeline. The report is pretty thorough, but its basic recommendation is just a national pharmacare plan that works like Medicare, end quote. Hoskins starts out by highlighting that Canadians spent $34 billion on prescriptions in 2018. Our healthcare system actually spends more money on drugs than we spend on doctors. Now, a lot of that is out of pocket or through private medical insurance.
That's over nearly 2% of GDP there. That's significant.
And that's one of the big things is this plan, we'll get into the money in a bit, but really highlights how universalizing it can bring costs down because it's a matter of just bulk buying for so many different kinds of drugs that we have lots of. Per capita, it says that Canada pays more per drugs than every other country in the world except for the US, who has notoriously bad per capita spending rates, and Switzerland. So we could do a lot better. And then there's the sad fact that, 1 in 5 people struggle to pay for medications. 3 million Canadians don't fill prescriptions because they can't afford them. And while 60% of Canadians do have private plans that cover pharmaceuticals, generally those plans are only covering 36% of what we spend on drugs. So, and most people will have probably been familiar with a private insurance plan, whether through school, through their parents, or through work. And when you get that, you always have a copay or a deductible. And so you go to fill your prescription and you still have to pay some money, or you maybe get it back later. And those barriers mean people aren't taking the medicines that are being prescribed to treat the conditions they have. And this creates a lot of knock-on health effects. So Hoskins takes that dark side and then goes, all right, well, how can we fix it? And he goes, well, simply put, the only way to really do it right is to do it all and build a pharmacare system that works like the Canada Health Act. That's universal, comprehensive, accessible, portable, and public, and just go from there. Obviously, the federal government has to build relationships with each of the provinces and territories to roll this out because it's their jurisdiction. But just like the Canada Health Act, the federal government kind of sets the floor and then throws a bunch of money at the problem and lets the provinces solve it. So in terms of rolling this out, Hoskins sets it out pretty straightforward. Start with a Canadian drug agency that will create the formulary. I think we talked about this in the 2019 budget episode because...
Yeah, when their interim report came out, I think was when we
So the 2019 budget actually rolled this out. We actually have a Canadian drug agency, and that agency is starting to develop a formulary in theory. Well, once it's created, but the funding is there for it. The formulary is the list of drugs that will be covered. It's just a fancy word that I like saying, so I'm going to keep saying it.
It's a database.
Yeah, but it's one that's based on, the best available evidence, what treatments are out there. Hoskins formulary would be rolled out by January 1st, 2022. So the initial approved drugs would start being paid by healthcare in 3 years, just under. That would be a smaller sample of all of the drugs. It would be the very easy to get ones, the simple ones, what most people are taking, probably a lot of statins and things like that. The goal would then be to, over the following 5 years, expand it to cover all of the more expensive rare disease drugs. And this is where the real difficult part is coming in. I think everyone probably knows someone who has had the diagnosis that's terrible and they find out, there is a drug that can treat that, but it's like $30,000 a year. Luckily, your insurance will cover most of that in most cases. But those are really tough, and these are the terrible situations that there's just not a good solution for.
Yeah, no countries really tracked that one. Most, like European countries, for example, they'll cover most drugs, but the very expensive ones, they'll often just make a decision that, it's not worth spending, hundreds of thousands or millions of dollars in some very rare instances.
It's a triage system.
Yeah, like that's the issue with healthcare in general, is that it takes up just a lot of any nation's resources to do it, and at some point you have to ration it.
Yeah, we'll get into the numbers, like I said, in a second, but it's one of those situations where I think 80% of the spending will end up being on 20% of the drugs or fewer for those rare situations. That said, the plan laid out in this report is that we keep adding drugs to the formulary until we have a full comprehensive system by 2027. Now, that won't include everything you can get from Pfizer or any other drug company, but it will be an evidence-based list with a arm's length body, that Canadian Drug Agency, who will have patient representatives as well, arguing for what medications should be covered. And so that's, I think, a good model to set up. The other end of the model is, what will it look like for you or I if we need to go get our drugs from the Canadian drug supplier? It points out in the report that, quote, there's strong evidence that user fees create barriers to access, and points out that anything that prevents people from taking the drugs they need, because you can only get a drug if you have a prescription. There's no real worry here about overprescribing, or at least that's a separate issue.
Yeah, the fairly solid argument for copays in medicine in general, in that, there's only so many doctor hours available in the system as a whole. The more frivolous stuff maybe should be slightly discouraged with a lowish copay. But, once a doctor's done the examination and go, okay, you need this, then you don't have quite that same incentive problem to avoid.
And so the copays recommended here are $2 for all essential medicines and $5 for other drugs. When I lived in the UK, I think it was £8 for essential meds, and there was a higher rate for rarer ones. So this is significantly cheaper than that, but we're still talking in the single digits. So for most people, this won't be a barrier. But he also sets out that there should be exemptions for anyone who's on social welfare or otherwise essentially can't afford to pay. And you'd also have an annual cap of $100.
It's $100 overall or $100 per prescription?
Overall. So 50 prescriptions, though. 50 prescriptions, or I guess 20 of the expensive ones, which is hopefully enough. But for some people, you need to get a lot of drugs. So these seem like reasonable copays that I'd almost want to dig into the full rationale of why $2 and not just zero at that point, because that almost seems like creating a bit of administration for, like, the transaction fees on $2 means the government's only making like $1.50. It's not a revenue generator, but maybe there's some reasoning they have for.
If every Canadian was to do it, at most you'd be pulling in, 3.7 billion? If every single Canadian spent $100 a year into the system, which, yeah, doesn't cover it off that much, although it's not nothing either.
But that's not counting the administrative costs of
Yeah, that's not
running
counting the
it.
administrative costs, and like, I don't think I've spent $100 in copay in quite a, you'd have to quite a ways back for me to rack up that much. Like, it's, yeah, there'll be a lot of people not participating in that much either. So yeah, it's not a huge revenue generator.
But in terms of the revenue they would need, Hoskins sets out that to get to essential drug coverage by 2022, we need to lay out an additional $3.5 billion per year, which is actually a very affordable start. The expensive bit, like I said, comes when you start covering all those rare diseases, and that's when your incremental costs each year get up to $15.3 billion by 2027. That's numbers pretty close to what the NDP got from the Parliamentary Budget Office for costing their pharmacare plan. So $15 billion is a lot, but we're spending $34 billion already. It's just now we're putting all our money together and we're spending half as much, which seems like a good deal. It's just hard to convince people that they should pay slightly higher taxes to pay less on drugs. Because the people, honestly, who need the drugs are older people who aren't, or retirees, or people with disabilities who generally aren't working and making as much.
Well, there's also people who have insurance through whatever other means who, in that case, there's less of a urgency on their part to get a national pharmacare program.
But here's the interesting thing there is Hoskins actually goes through and looks at what businesses will save, because he highlights one of the stresses is that as these drug prices keep going up, insurance company plans keep getting more expensive, and businesses are starting to feel that stress as they're being demanded to cover insurance costs for their employees. And so he predicts that this plan will save businesses $750 per employee per year, which is reasonable, or, a moderate, not a tax cut, but savings for any business. And making that discount across large businesses especially can start to save a lot of money. So this is a plan that's actually good for business, good for citizens, and it just takes some political will to build. And on the practical side of the plan, to roll it out, obviously the federal government needs to make deals with every single province, but Hoskins recommends a new dedicated fiscal transfer. Essentially, you have the Canada Health transfers already, just slap another one on there, and that transfer would be based on essentially how much drugs does that province need. So a province with an older population or one that just for random other variables needs more pharmaceuticals than the next province over, they'll get a bit more money per capita, which all seems reasonable, and that's up for review every 5 to 10 years. The one recommendation that's really interesting that he suggests is essentially making it a constitutional level difficulty to change the pharmacare plan once it's introduced. Basically, he says, changes to pharmacare, including funding, would require approval of Parliament and 70% of provinces and territories representing 2/3 of the people in Canada.
But how? Parliament can't pass a law to bind the hands of future parliaments, and you're not getting a constitutional amendment through because it's practically impossible, even when everyone's more or less in agreement it's a good idea. And there's a whole bunch of provinces with premiers who are not necessarily going to play ball on this one.
I would actually have to look at how the Canada Health Act itself works. I don't know how the funding negotiations there work, but I guess ultimately it would be like an internal trade deal kind of situation, but for drugs.
But there's still nothing that changed it, because, but for example, the Harper government, I think, unilaterally moved to change the rate of increase of the Canada Health transfer. So, you can have negotiations. You can make it a political norm that you have these negotiations, but you can't really lock it in.
I think maybe he's hoping for that norm, but doesn't have really any way to go above and beyond that. Overall, I think I was pretty excited to see this plan. I saw a lot of people on Twitter equally excited, but my Twitter is a very bubbly place. The one, thing I note is we talked about the NDP pharmacare plan when it came out. The key difference is it's less detailed, but it has a minor copay as well. That one is for the NDP is $5. The biggest difference is the NDP somehow thinks they could roll this out by late 2020, which I'll give them points for ambition. And I'd rather start with a goal that's way too early and end up at 2027 than start with a goal for 2022 to 2027 rollout and end up like, maybe this will come after 3 or 4 more federal Liberal mandates, which, let's be clear, 2027 is not in the next majority government of Justin Trudeau, assuming he wins in the fall. Which I guess brings us to the political aspect of this. Is Trudeau going to run on this plan?
Yes. The Liberals have health, Canada's, the country with universal health care is kind of like part of their core identity in a way. Even though we're not actually that unique on it, but doesn't stop the Liberals from constantly patting themselves on the back for being the party that brought it in federally.
Well, they haven't even officially endorsed this plan.
I mean, they've been dropping hints, though, all along that they want to do a pharmacare thing.
Now we just have to see if they'll commit to it.
Well, it'll probably be like it usually is this will be in the platform, it's something we want to do. The promise will be less detailed in the report, and, well, we'll see what actually happens once the new term starts.
And so that brings in an interesting element of the federal election debate, because you have the NDP leading on this, with the Liberals now adopting a largely similar plan, assuming they take this Hoskins report. The Conservatives won't touch anything like this. They will probably say they're committed to trying to make drugs more affordable for Canadians.
Scheer's already said that.
Political commenting is so easy. The Greens might say they endorse this, but no one cares. And so is the election just inevitably going to be the Liberals stealing NDP platforms and running?
Well, yeah, they're going to try and keep the distance between them and the NDP fairly small, so there's no reason to defect the NDP, and they can play the usual, we're the only ones who can stop the Conservatives game. And I imagine the NDP will try and wedge that distance as far apart as possible. Whether or not they succeed, it's going to be another question.
Well, I think where there is maybe some room for that is on the credibility question, because pharmacare feels like one of those issues the Liberals have been talking about since healthcare was introduced, and it's always that perennial, that or childcare at the federal level is like, just give us a couple more terms. We just need 2 more terms to bring it in.
Yeah, but I feel if you're the type of person who's been really watching pharmacare policy for years, you're not going to be fooled by this if this isn't a legitimate thing they're doing. They're just trying to win votes on it. But for your average Canadian, I'm not sure that's the perennial Liberals' procrastination on these is really going to be that off-putting.
Well, I think there's a lot of people who still see Chrétien as betraying a number of his promises, most notably the GST, but there were a few other ones in there, and people won't remember the specifics, but they are these kind of, we'll bring in this big platform, or we'll bring in this big policy. And when you look at Justin Trudeau's first term, where we have several big broken promises, notably electoral reform, but for many people, they also feel like his decision to buy the Trans Mountain Pipeline betrayed things he didn't say.
Yeah, I think that's going to be more salient than, okay, the Liberals don't have a great record of fully implementing their platform when they get elected.
And so if they don't have that credibility, can they sell this plan better than the NDP? I mean, the NDP is not doing well in the polls, so I'm answering my own question.
We'll see when the campaign really gets to him, but if Trudeau can ease off how smarmy he sometimes seems when he's trying to deliver the aren't we great stuff, maybe. Moving on to the quick takes, there's a new report out by the Parliamentary Budget Office saying that we're not going to meet our Paris climate targets if we just rely on the federal government's carbon tax policies. And in order to meet those targets with those policies and all the other climate ones announced, we basically need to double the carbon tax by 2030 and put an additional $52 a ton above what's already planned. So that would bring it up to a total of $100 per ton in basically a decade from now.
On the day-to-day level, that would mean an additional 23 cents per liter of gas by 2030, which anyone driving in Vancouver will have seen it bounce by that much in like a matter of weeks, so it doesn't mean anything. It's really interesting to see this report come out. The Parliamentary Budget Office has built a lot of credibility through its work on various files, and for them to start looking at our carbon tax policy and climate change, I think is really interesting. The other element of what they point out is this additional $52 per ton needs to be broader than the existing carbon taxes. I think we talked in our previous discussions on the climate policy of the NDP and Greens, how the federal government's carbon tax treats different industries slightly differently. And there's some good argument for that. But what the PBO is saying is we need an additional $52 per ton that's not as discriminatory, that's just really pushing fossil fuel companies to go out of business effectively. They don't say it like that, but that's what needs to happen. The challenge with this number is we've not talked about any political party that's willing to go this far. Now, the Greens and NDP climate plans do talk about doing a lot of other things that might make up some of that gap, but in terms of floors that we need to work from to meet our climate targets, we're not in a good spot.
Yeah, there's definitely more that needs to be done. Although, to put this in perspective, this wouldn't exactly be unprecedented. Sweden has had a carbon tax since 1991, and the current price of it is $139 US per ton, rough equivalent. So they're doing fine. It's not like this is some far out policy.
Yeah, I'm not against the policy.
Yeah.
Neither of us are, I don't think. It's just all the political establishment in this country is. Like, I don't see Trudeau running on we're going to double the carbon tax that 2/3 of the country hates. Like, they just announced that they're going to slap it on Alberta after Jason Kenney killed their own provincial carbon tax. So he's now picking fights with Alberta. Now, he's following the rules he's laid out for provinces. He's got to fight on with Ontario, fight on with Manitoba and Saskatchewan. So it's not a good situation for the fate of the planet, essentially.
Yeah, politically Trudeau's going to be just trying to hold steady on this one. But this does give maybe a little room for the Greens or maybe the NDP to kind of push things a little more on the carbon tax file and try and shove that Overton window over one direction so the Liberals don't look quite so radical with their $50 a ton. And pretty sure if BC had kept their escalator in place before Clark had frozen it, it would have hit that point or gone past it by 2030.
Yeah, I don't remember what its increase was, but yes, we can do this. We just need to build the political will somehow. So while Justin Trudeau is fighting the provinces on the carbon tax, he's also fighting the Senate, and notably many of the Conservatives in the Senate, over Bill C-69, which I think we've alluded to a couple times, but we should probably dig into it because it's the biggest federal story right now as Parliament and the Senate try to finish their work before the election, essentially before summer in the election. Bill C-69 is the environmental assessment overhaul legislation that Trudeau's been slowly trying to get through. The Senate brought forward 188 different amendments to the bill after months of study, and senators went across the country meeting with people and actually doing a lot of work. And they passed these amendments in the Senate, so it goes back to the House, and the government said, well, we'll take 62 of your amendments. And a big chunk of the amendments that the Conservatives proposed are just left on the cutting room floor, 90%, unsurprisingly. So now we're in another House-Senate standoff situation, which is now becoming a regular feature of our quasi-independent Senate, where the Senate has proposed a number of changes to a bill. The House rejects most of those changes, bounces it back, and then the Senate has laid down most of the time. This happened on medical assistant dying. This happened on a couple other justice reform bills. But now that we're so close to the election, it's feeling like the Conservatives in the Senate don't want to lay down this time. And it'll be interesting to see how tooth and nail they fight to keep these changes. The dividing line on this bill is whether you think it will provide some reasonable and necessary protections to make sure that when projects are built in Canada, the environment is taken into consideration and Indigenous people are consulted, or if you think this will kill all construction of any major project in Canada forever and everything will be ruined. which is like legit the rhetoric coming out of Alberta and others. 6 provinces, the Conservative provinces, wrote a letter to the Prime Minister this past week, an open letter, saying they have deep concerns with this bill and want it shelved or want it thrown in the dustbin. And Trudeau came back saying this letter, signed by 6 provinces, is a threat to national unity, which I find amusing because when you have a majority of the provinces saying something, I feel like they're more united. Even though I disagree with them, they do represent a certain unity.
It's not nothing that there's some concerns there. I mean, there's obviously a partisan angle to it, especially the election coming up, but there are some very stark regional differences in this province when it comes to stuff like the resource industries, and that's something that has never really been figured out. So, Dud Ford is definitely leaning on this because he hates Justin Trudeau more than, he's really concerned about the resource industry probably, but shouldn't casually be dismissed either.
Yeah, and I think it's interesting to see that the government is accepting a number of amendments now, including several Conservative ones. I don't think either of us are anywhere near versed enough to comment on the legitimacy of the bill itself as it was first introduced, or any of the amendments that have been thrown at it. But just watching this politicking has been fascinating, especially given the timeline and how compressed it is. Like the fact there are so many major pieces of government legislation still awaiting final votes is quite telling for Justin Trudeau's ability to have gotten through his legislative agenda.
Justin Trudeau isn't the only one annoyed with a somewhat contentious situation in the Senate. As former Conservative MP and interim leader, went to Twitter to take the Senate to task for possibly failing to not get a bill requiring sexual assault training for all judges through. This is Rona Ambrose I'm referring to, who before leaving Parliament had put forward a private member's bill to that effect. But currently the procedural delays, the Conservative senators are trying to enact to delay the UNDRIP bill, is having some knock-on consequences.
Really fascinating to see Rona Ambrose speaking out against her former colleagues in the Senate. The House and Senate are different beasts, of course, but unlike the Liberals, the Conservatives never disowned that part of their family.
Scheer's giving indication that he intends to go back to the way things were when it comes to Senate appointments.
Well, and the other element of this is this sexual assault bill was brought forward by Rona Ambrose, I believe, in the first place, and is supported by a number of Conservatives. I think it has pretty cross-party support, so it's not a controversial thing, but just the way the procedures of the Senate work, they have to debate the bills in the order that they're on the paper, and this UNDRIP bill comes up first. That one received support in the House of Commons, and it's now just Conservative senators using procedural tactics to filibuster it rather than actually just bring it to a vote where they say, all right, we don't like it because XYZ, but we'll vote against it. You kind of hate to see this kind of politics. Like, there are some things where I feel like maybe it's justifiable to make the moral argument that this bill is so bad that if it's passed, all hell will come loose. And I guess that's the argument they're trying to make about UNDRIP, because they feel it will give a veto over resource extraction projects, but it won't, because it doesn't immediately bring UNDRIP into law. It just sort of commits the government to starting to work towards that, which again, like you've said, can't bind a future parliament. And you're putting other valuable legislation at risk on this type timeline. So I just, really found it interesting to see Rona Ambrose speaking up. And so credit to her for that. Imagine the world where she was still the Conservative leader and you didn't have Scheer at Yellow Vest protests. The final thing I wanted to touch on, just back here in British Columbia, is something that's kind of been simmering in the background and might blow up soon. And this is the ongoing contract negotiations between the provincial government and now the BC Teachers Federation. The government has been quietly signing agreements with all the provincial unions and generally getting them all on board with 2% raises, which is going surprisingly well. Like the fact you have a government signing contract after contract with major public sector unions and they're all coming to a general agreement has been relatively it feels unprecedented for British Columbia history. But of course, the teachers are always going to be the strongest union, the most militant, based on their history. If you know much about BCTF history, they also have justifiable reasons to be obstinate at this end, because they just won a major court victory saying the language in their contracts on class size and composition shouldn't have been torn out. And what the BCTF is claiming now is the NDP government has come to the table saying, well, let's look at that language and maybe tweak it. And depending whether you believe the government, who says we just want to modernize it, or you believe the union, who says they want to tear it up again like the Liberals and make everything terrible. The truth is probably somewhere in the middle, but it makes for a tense situation for parents, teachers, everyone touching the education system who doesn't quite know where this is going to end. Now, the other background issue is BC teachers are in many cases on the lower end of the national average for pay rates, and they're hoping to make bigger gains. But with these legislated 2% increases, if teachers get a more than 2% raise, it triggers what's called a Me Too clause in every other union's contract, which would then give those unions a greater than 2% raise. So there's no motivation for the government to do that.
Yeah, and in fact, those clauses introduce a perverse incentive into the system overall, and maybe aren't the best on public policy grounds.
It means you're going to fight hard to make sure you only get 2% raises for everyone as a government negotiator. Now, what's happened, I believe, for nurses' unions, and what's been talked about for the teachers as well, is one way to rectify this is to do either one-time bonuses or add different elements to the salary grid, or give bonuses for people who work in remote locations or with extra special needs students, or find other ways to compensate, to bring that compensation up without it being a flat salary raise. And I think that's all on the table and isn't as contentious as this class size and composition issue. The other thing that came out is the government generally releases class size composition numbers early in the spring. I think in February, we found out that the class size numbers were out and there hadn't been a significant improvement on that, but we still don't know the composition numbers. So we don't know how many classes have students with special needs or require extra support. Now, the old contract says there can only be so many students with special needs in a classroom. But I can tell you from not firsthand experience that there are a lot of teachers in classrooms where they are exceeding those. And what generally happens is the district will pay out a couple extra days of compensation. So you can, you've had to deal with a lot of high demand students for this year. Here's an extra day to prep to help you, recover from that, catch up on your other marking. The point being, the government's not meeting the targets it already has. And so the union's in a militant stage of, you need to get us to where we're supposed to be, and then we can talk about this. It's also very weird to see everyone kind of negotiating in public. Usually these negotiations don't happen on Twitter like they seem to be going on right now. So all of this is fascinating and worrying as to where this is going to end up in September when classes return.
Yeah, it's not great for the students and parents. I think for those who were worried the NDP were going to be too friendly with the unions, and some of the stuff like the community benefits agreements when it comes to construction contracts, for example, did play into that a bit. But, this has not been that case. So, maybe those people should feel a little reassured. I'm sure it won't stop Andrew Wilkinson from trying to take the government to task if it does end up going to a strike.
We'll have to wait and see. In the meantime, listeners, remember to fill out our survey at politicos.ca/survey.
And that has been Politicos. Find links to everything we talked about at politicos.ca. If you're a first-time listener, make sure to subscribe and let us know what you think. Support the show and get access to our exclusive Slack channel at patreon.com/politicos. And if you have ideas for the show, feel free to send them to us. Our intro music credit is Beautiful British Columbia by Saoirse Plotnikoff. Thanks for listening.